Hello. Today we'll discuss some of the triads in the pediatrics. Okay, I have written only 7 triads here in this video. From next video we'll cover remaining triads. Okay, so first starting off with the prune belly syndrome. So in prune belly syndrome, in NEET PG they can ask all of the components form the triad of your prune belly syndrome except. Okay, fine. So in prune belly syndrome you have abdominal wall defect, that is abdominal muscle wall will be defect. Then you will have genitourinary defects and cryptorchidism, that is undescended testis. So cryptorchidism, abdominal wall defect and genitourinary defects, these form the triad of your prune belly syndrome. Next is hemolytic uremic syndrome. In hemolytic uremic syndrome you have anemia. What type of anemia you have? You have microangiopathic hemolytic anemia. So this is your microangiopathic hemolytic anemia along with renal insufficiency and thrombocytopenia. So the triad that is forming in your hemolytic uremic syndrome are renal insufficiency, microangiopathic hemolytic anemia and your thrombocytopenia. Next, coming to your Alport syndrome. In Alport syndrome you have a triad of hematuria with high frequency sensory neural hearing loss and anterior lenticonus in your eyes. So the triad that is forming your Alport syndrome are high frequency sensory neural hearing loss, hematuria and anterior lenticonus. Next, HSP, that is Henoch-Schleiden purpura. It is not triad, it is tetrad. In tetrad you have the findings of abdominal pain, arthralgia, renal insufficiency, and next main one, it is non-blanching, that is palpable purpura. So the tetrad that is forming your Henoch-Schleiden purpura are abdominal pain, arthralgia, palpable purpura and renal insufficiency. Next, coming off to the West syndrome, now it has been named as infantile spasm. You have triad forming or composing of clinical spasm, developmental delay and the specific EEG finding is hips arrhythmia. Okay, so this forms the triad of your infantile spasm. Next, going off with the Lennox-Gastaut syndrome, it has a triad of multiple seizure type. Next, you have a developmental delay in the child and you have a specific EEG finding of 1 to 2 Hz spike, polyspike and wave pattern. Here in this EEG, the child will have a spike pattern or polyspike pattern when the child is sleeping and the child will have a slow pattern when the child is awake. That is the main specific EEG finding in Lennox-Gastaut syndrome. Next, you have Miller-Fisher syndrome. Miller-Fisher syndrome is nothing but a variant of your GBS. You have the features of ataxia, areflexia and ophthalmoplegia. So these are the triads, main triads in your pediatrics. Thank you. Have a nice day.